first of all, just introduce you to Amanda. She's an absolute rock star, lover. She's a recent graduate of the Functional Medicine Fast Track program. So yeah, big welcome to you, Amanda.
Hi, thank you for having me.
Super cool. Yeah, so it's a joy. We don't do these live case studies often, but when we do them, we just love doing them because we can bring on these amazing practitioners, health professionals like Amanda, just to show you, what's happening out there and share a little bit of their life. And at the same time, we're going to go through some clinical case studies tonight. So it's going to be a lot of fun. But Amanda, do you want to maybe just give a little bit of background from your side, just who you are, where do you stay, what's your profession, some of those basics, and then we can dive in from there.
Sure. So I'm a physical therapist. I've been a physical therapist since 2006. I don't want to do the math because that just tells you how long I've been a PT. But I live in Montana in the US, and I was searching for my own health issues that I was having and looking for answers, and came upon functional medicine. And when I was doing research, I found this program and saw that if you had a health degree and were part of that profession, that you could do the class yourself. And so I thought, to heck with finding somebody that can help me. I'll learn a little bit and try to help myself. So that's how I mean, it was a long process. It wasn't like in a day, but definitely happy that it happened that way.
Love it, love it. Super cool, super cool. So take us maybe back to a moment when you realized, okay, you couldn't quite, you didn't want to continue with your skill set. You obviously got really good at it. You've been doing it for over a decade. What was that point when you decided, I've got to change my skill set? I don't want to continue down the same path. And what was the final straw?
Yeah, so I was in traditional home health setting, and our company had got bought out by a larger company, and it just kind of got worse and worse. And I didn't really like the ethical and moral background of where they wanted it to go. So I took a jump and started my own PT practice. So I do a cash-based mobile practice, but I do a lot of hands-on therapy treatments, and just kind of realized that my hands aren't going to last forever. And I just wanted to be able to still help people in a way that I treat people for physical therapy is very well rounded, like trying to look at the whole picture, not just that they have a shoulder injury. So when I started to learn about functional medicine, it was just like a light bulb went off that this is how my brain works anyways. Now I get to help the whole person at a very deeper level, and realize that a lot of people that I wasn't able to help get completely better, I realized that they probably had something else going on. It wasn't maybe my skills not able to get them over that last little bit of pain decrease or whatever they had going on. They probably have something going on at a systemic level that functional medicine would actually be probably the answer for.
Got it, got it, got it. So what were your biggest fears or doubts about transitioning to an online functional medicine practice?
I think I was just nervous about kind of that imposter syndrome. Like, did I really know enough to be able to figure out these very systemic processes where you have to try to problem solve and figure out where the person's main dysfunction is in their body that's creating all these other issues? But then when I got into it, the training is just so lovely. I mean, it just walks you through it, and I totally got rid of that. Like, oh, I do have a good enough basis to be able to do this and really help people.
Love it, love it. Super cool. Would you mind telling us or describing a little bit of the financial stress you may be under running your own cash-based practice before that? And, was it affecting maybe your personal life, or where was it affecting?
Yeah, so I live in Montana, and the town that I live in is a population of around 9,000 people. So it's also not a very high socioeconomic status place. I mean, so when I tried to do the whole cash-based thing, it was scary because I didn't even know if people would want to pay for physical therapy services. But I mean, that actually went really well, but I'm limited to a very small population with my PT practice. So having the ability to market this, you know, basically worldwide if you wanted to, but just even just to the US and other states, just opened up a whole nother level of income for me and my family, for sure.
Got it. Got it. So maybe just can you describe the story that you were under when you decided to invest, but you didn't have those resources? How did you kind of find those resources? Because that's an interesting story.
Oh, as far as getting into the program?
Yeah.
Yeah, okay. So I had a patient, this is a really long play. I had a patient when I lived in another city who I basically treated for an elbow injury. And then anytime he ever got hurt, he would just come back to me because he's like, I know you can fix me before it gets bad. So he was my patient multiple times. And this was before I was even married. So this was in like 2010. I kind of just kept in touch with him over social media. And when he saw that I started my practice where I live now, I live an hour and a half away from him. He said, I want somebody to work on my shoulder. I'll drive most of the way to you if you'll work on me. So I was working on a shoulder injury for him. And I mentioned that I wanted to do this. And he had told me that his naturopath had gotten so busy that he couldn't ever really get in with her anymore. And he invested the money for me so I could do this as long as he could be my patient. And so he also owns 5% of my business for 2 years. But I totally jumped when he brought this up, and it was a no-brainer. But when you talk about being resourceful, I kind of take that to heart because I didn't have the money to do it, but I was saving. But he paid the extra for me to do it, so that was kind of probably a non-conventional way people jump in. But
Amazing. Yeah. You put it
yeah,
out there and you don't know where things come from sometimes. And yeah, the
yes.
relationship you build and the bridges that, yeah, they can help you towards. So I love that. Can you possibly share a moment when you felt like giving up and what kept you going?
During the program, I had a little bit of a rough. I think I was in week 3. My uncle committed suicide, and about 2 weeks later, my grandma passed away, and then 4 days later, our family pet passed away. I had a really rough, and I didn't know how I was going to keep up with learning the vast amount of information and staying on track because I don't like not being very. It's like the PT in me is like, we have to stay on the plan and we have to keep up. We're very kind of type A. But just having all the support of the whole team. I mean, I was cheered on the whole time, and having the mindset coach meeting with Tamara, like she totally talked me through it and supported me. But I was definitely like, I don't know how I'm going to do this. And it, it wasn't, I mean, the amount of information is a lot to do, but it's just so fascinating, and you know that you're going to be able to help so many people. So it's easy to stay on course, but when you have those life things that get thrown at you, it just reaffirmed that I was in the right program when I had so many people rallying around me to help help me get through it and get through all the information, but also feel supported and acknowledged with what I was going through.
Oh, I'd love that. Yeah. Yeah, I know you got an amazing community that follows you and you've had some amazing patients. Can you describe one patient success story that wouldn't have been possible and what were their outcomes?
Yeah, so I had a gal who I actually her son and my son are very similar age, and we were riding up the ski lift together when we were chaperoning their ski day. And she was telling me about some neurofeedback stuff she's doing with her counseling program, and I was telling her that I was taking classes and I was taking this class, and I said I have to find some patients. She said, oh my gosh, I'll be your patient. I didn't know anything about it, but she had this rash that she's had for 3 years that just kind of traveled in her body. She had a lot of gut issues, but the rash was her main thing, and it was causing a lot of dysfunction in her life. I mean, she didn't really want to like be in a swimsuit and go on vacation with her family. And she said she was using hydrocortisone cream as lotion. Basically every day she was using it as lotion. And so she was my guinea pig patient when I started the program. And I actually just saw her tonight at the beginning of the back to school night. But yeah, she's had no rash. We figured out what foods were bothering her. Her gut was kind of a mess, like much like lots of people. But yeah, we figured out what she needed to do for her gut health. And then she reintroduced those same foods that were causing her a rash, and she doesn't have anything anymore. And she said that the program was worth its weight in gold, and also hydrocortisone cream.
Amazing. Love that. Yeah. So something you wouldn't been able to do as a PT prior. Those are new skills you have, new
Yeah.
outcomes. Yeah.
Yeah.
Absolutely love that.
And I mean, she had a lot of other things that have improved a ton too, but just um, the visual symptom that she was having, like this rash that she'd finally get it to go away and it'd pop up in some other place in her body. And it just was never ending for 3 years. And now she hasn't had it in months. So she's very happy with that.
Amazing. Amazing. Okay. One last question, then we'll jump into the case study for tonight. How's your work-life balance changed since starting your online practice?
Oh, it's so lovely because I get to kind of schedule patients when it's a little bit more convenient for me. I don't know if all PTs are like this, but when I started my practice, I needed to make it work. And so I was taking patients at 6 a.m. and I was taking patients at 7 o'clock at night, and I was missing out on family time. And now um the fact that I get to charge kind of what I'm worth. I know that sounds weird to say about yourself, but um, charging what you're worth and also seeing great outcomes is so nice in and of itself, but also getting to schedule it around the weird job that I have in my hometown where I take care of all the high school athletes. It's nice to be able to schedule it around that too, and do something that I really love, but I get paid nothing to do. I mean, I get paid a little bit, but it's not anything. But it's nice to have that other income, but also that is super flexible around something that I really love to do. It's really
Love it.
life-changing, actually. Yeah.
Super. And what are you currently charging for your programs?
So my current programs are 4,000. That it does include a CSAP test, just because I think it's so vital, and I didn't want that to be an option for people. I didn't want them to have to do it on their own in case they wouldn't do it. Because I just think if it's included and you have to do it, then we'll get more results. So I planned it that way. But I'm also meeting with a couple businesses in Montana to provide their employee wellness programs. So that will be a different program fee because it'll be paid for by the business each month. But that will be a nice income too that I couldn't have done because I wouldn't have felt qualified to offer such a diverse wellness program before.
Yeah. So your programs are currently $4,000 at the moment. And then maybe just describe briefly the story that you told me where you had the lead from New York, New Jersey, and then
Yeah.
you've got them referring patients to you. So now these are patients out of state now that you're working with.
Yeah. So I have a health coach. That seems weird when I'm what I do, but mostly he builds me my workout programs, which is nice. And he keeps me on track for nutrition stuff. And, it's just kind of nice to have a coach and have somebody else holding you accountable than yourself. But he's in a group of fitness coaches with this guy who was having all these gut issues, even though he eats really well, eats really clean, works out a lot, is a very healthy, fit individual, but was having all these gut issues. So my health coach referred him to me. And I mean, he's doing so well, probably because he's very motivated to take care of it, but he's doing so well that now he's referring his own clients to me from New Jersey. So that's really cool. I have no contacts in New Jersey,
Love it,
but
love it.
it's very cool.
So yeah, so that's the braveness in the decision you made to build this online business, new skill set, and now you're working with people that you wouldn't have been able to work with if you were just doing your cash-based PT practice.
Right. Right. Yeah.
Cool. Love it. Okay, let's dive into the clinical case. Thanks for sharing that. I'm going to share my screen now, and we are going to jump in and go for it here. Let me move a few things around so I can see everything. And so this is, Amanda, do you want to introduce the timeline and go through it and just let them know who we are speaking about here?
Sure. So this is mine. And this is my handwriting, which is kind of weird to see on the computer. But so family history, my family on both sides has history of hypertension, high cholesterol, and on my mom's side, type 2 diabetes. Um, Now that I know a little bit more, it's probably based on diet and whatever, but we won't go into that. And then, so my daily stressors were at the time were financial, work duties, just because I was trying to make my cash practice work, and then taking care of, I have 3 kids, they're 11, 9, and almost 7. So a little bit busy as far as that goes. Uh, my timeline, I mean, I didn't fill it. It's kind of weird to fill in your own timeline. So it could be probably more detailed, but I was born in 1981. My mom did not breastfeed. It was a vaginal birth, but didn't, my mom at the time, they were just very pressured to formula feed. I don't know. That's what my mom said. My mom said no one gave her any support to breastfeed, but it is what it is, right? Um, I had very standard American diet as a kid, but my parents, we didn't eat out a lot. I didn't. Plus, we live in I mean, it's way bigger than it was when I was growing up. We didn't even have a fast food restaurant here, so I didn't have fast food. But I did just eat very standard American diet. My parents don't know a lot about nutrition, but we did have home cooked meals almost every day. Um, I had some injuries. I played multiple sports. Mostly the injuries that I had were ankle and wrist injuries, volleyball, basketball, track, softball, all the normal things. But those are my main injuries. I never had anything super traumatic, but I did break my wrist and many, many, many ankle injuries. In 2012, I had my first baby after 44 hours of labor via C-section. It wasn't a traumatic birth, but it was traumatic in the sense that I had a midwife, I had a doula. I was very set on having a very natural birth, and it didn't go that way. So I think I mourned my birth a little bit of my first baby. Then I had this recurring pilonidal cyst happening. So I had it in 2012 after I had my baby. It was probably a month after I had my baby. I was home for Thanksgiving and I had to have it lanced, and I had to have, an open wound that had wound care, all that. It didn't go away because they didn't do the second procedure to take it away. I don't know why. And then I had a miscarriage in 2013, and it came back. The pilonidal cyst came back. It has nothing to do with birth, but I don't know why that triggered it. Had it dug out again. They again didn't do the final procedure to get rid of it. After I had my baby in 2014, which was a vaginal birth, it came back again, but I happened to not be able to get in where I used to live, and I got in my hometown now that I live in, and the guy was like, why didn't they do the second procedure to actually get rid of the node that gets infected? But so he did that, but I had a lot of stuff happen right after I had babies every time. So I did do a vaginal birth after my C-section, which was lovely. And then 2017, I had the birth of my third child, which was a vaginal birth as well. I bought the surgeon that did my pilonidal cyst. I bought him a whole tray of sandwiches and brownies because the pilonidal cyst did not come back after my third baby. I was very thankful. Then in 2020, I decided to be a surrogate, a gestational carrier, for a couple that I didn't know. but got matched up with, and I had a miscarriage the first time they did in vitro, which was very heartbreaking. But then I ended up getting pregnant with the second round of in vitro and had that surrogate baby in 2021. And after that, that is when I didn't feel great. You have to do a lot of things to have an in vitro. I mean, I'm sure a lot of people on this call have struggled because infertility is a big thing, but to have in vitro to begin with is a lot. I had to be on thyroid medication to get my thyroid levels in a very, very narrow range for in vitro. My thyroid wasn't out of whack to start, but just because they have to have it in a very narrow range, I was on that. I also, you have to take medication that keeps you from your body from rejecting the embryo because it's not yours. So I don't know if that played into it. And then I had a C-section for the birth, and I had a lot of weird things after it. And just, I think not taking care of a baby afterwards and not breastfeeding. I did pump for them and ship it to them, but it's just a weird rebound coming back from having a baby when you don't have a baby to take care of, and all those things that normally help your hormones, I think, get back into their normal. It also could be that I was 41 when I had her, or almost 41 when I had her, but I just didn't bounce back like I did after my other pregnancy. So that, I think that was like the final straw when I did not feel good from that point on.
Okay, got it, got it. So let's move to our quick view sheet here, because we can continue with kind of the main symptoms, main concerns at that point or this point. So also to bring this into context for everybody, Amanda did this towards the beginning of her program with us in Functional Medicine Fast Track. We generally support almost every health professional going through Functional Medicine Fast Track with their own health. So this is at that point, she's also going to show you the difference in what we call a MSQ from then to now. So bear in mind where the context of this is.
Yeah, so this is back in February. My main concerns were just I didn't bounce back like losing weight like I had done prior when I had babies. I had very low energy. I was taking a nap every day. I was using caffeine to try to just make it through the day. And just low libido, and also just I felt really I guess more cranky and irritable right before my periods, which I didn't usually have that before. I mean, everybody has their moments, but it just wasn't a normal occurrence for me. And my weight was the highest it's ever been. I just didn't feel good, but no matter what I did, just nothing seemed to help. I had seen my regular doctor. They'd even tried to put me on some medications that I can't even remember the name of anymore to help jumpstart it, but it didn't do anything.
Got it. Got it. Okay, super cool. So this is really a summary of Amanda's like intake form. And what we're really looking at here is, let me just switch this off here for a sec, so I'm not getting this on. Not letting me do anything now. Okay, let's keep going. You just stop
Do you want
sharing.
me to, yeah, do you want me to go to like allergies or, um,
Let's do that. Let's keep going. So let's go quickly through anything in allergies that we need to be aware of.
yeah, no real allergies. I have a weird reaction to pain medications. I just feel loopy and whatever, not myself. So I just didn't ever use them. Um, and then I was really susceptible to like cleaning products, like harsh cleaning products and scents and all of that. But I just thought I was just one of those people. But I found out more later. I wasn't taking any supplements. I had tried prescription meds for thyroid. My vitamin D level was really low. they tried me on these things to help jumpstart my weight loss. It didn't make me feel great, and they weren't effective. As far as like previous interventions. And then sleep, I always fall asleep fast. Uh, I mean, as soon as my head hits the pillow, I don't really wake up at night, but when I would wake up in the morning, I did not feel rested. Physical activity, I play volleyball. I ride my bike. We do a lot. I mean, I walk and am active with my kids, but I didn't really have a regular exercise routine, but it was because I didn't have enough energy at all to do anything. Um, I mostly had a standard American diet, probably because I didn't know any better until I started doing this. I mean, we cook a lot at our house. We don't really go out to eat a lot, but I do drink a lot of water, but I was having to supplement with caffeine because of very low energy. My stress relief was I take a shower to relieve stress, and then more like arts and crafts kind of projects, along with just being active with my kids. And then as far as relationships and social, just, I have a good relationship with my husband, and I have a lot of friend time, but usually friend time with people who have kids that do the same activities as my kids. And the stress in my life was probably some relationship stuff with some of my family members.
Got it. Got it. Okay. And it's important that Amanda's telling you this, because we're going to pick up certain things in the labs. So bear in mind, we need to be going through the timeline. We need to be going through this detail, because we're going to see where we can pick it up in the physiology. What's happening in the pathways? What do we need to look at to rebalance?
Yeah, I mean, I thought some of these things when I filled them out were just like everybody had this, and it had nothing to do with anything internally. So it really does relate a lot to some things. In the assimilation area, I've always, ever since I was little, no matter what I did, I always had cavities, which drove me crazy because I was very diligent. Bottle fed. Um, I was constipated. I didn't know that I was constipated. I thought that's what everybody was like.
Yeah.
And I do get dry scalp at times. And I
Okay.
always just related that to I live in Montana and it's not humid at all.
Got it. Got it. And again, those two are important. We want to pick these up because we're going to be looking at stool samples now, and we want to see, okay, what is happening in the gut?
Yes.
Skin is related to the gut. The skin, the lungs, and the gut, they all are one. That's the assimilation organs. So
Yes. Yes.
the
And
dry
I did
scalp,
what
yeah,
when I was younger, I did have acne really bad too, that didn't
got it.
respond to anything. So also of note.
100.
uh
So let's just look
just
for
kind
the
of
kind of
oh
look
go
for the
ahead.
highlights here. So
Okay.
let's have a look at energy, and
Yes.
tell me a little bit about those.
Yeah, so again, ever since I had my surrogate baby, I would be tired all the time. I didn't wake up rested. In the afternoon, I couldn't wait to take a nap. Um, I before I had kids, I'd never even drank coffee. I didn't even drink coffee in grad school, but I was drinking coffee in the morning, and then I would have a caffeine drink in the afternoon just to make it through the day. And just poor mood and libido, especially around my cycle. The other main things were just that I couldn't lose weight, and I just wanted to be healthier, and I didn't want to be going down the path of just having all these health issues that keep building on and building on as you age. And I just didn't want to be there. I have an uncle that's 101, and he still drives and doesn't use any walker or cane, and he's very active. And I just like, he's kind of my role model that I wanted to be like. He's in very great health. He takes one medication.
Crazy. Yeah, that's amazing. Yeah, great genetics. So we can,
Yeah, yeah.
yeah, super.
Um, Yeah,
Yeah.
so my plan was to do, I mean, this was a long time ago. But elimination diet was the first thing to do my CSAP. I didn't even know how to spell CSAP at the time. That's really funny. And the DNA and the Dutch. And then those were like the supplements that I thought I needed when we first started.
Awesome. Okay, so this is the chart that I was talking about, the MSQ. Let me see if I can make this bigger. It's not coming bigger for some reason. So our medical symptom questionnaire, and this is what we wanted to highlight, is that the score, total score here was 48. And some of the big areas here that were coming up was weight. You'll see energy coming up, and then emotions, pretty much what Amanda was describing. Okay, we did have stuff in the gut area here as well, but the total was 48. And remember, this is now going 6 months back. So Amanda has redone this, obviously had her own plan, working through her supplementation, her nutrition, her lifestyle factors, and this has changed, which we're going to show you towards the end. Anything else you want to bring up here, Amanda?
I think just that it was kind of eye-opening that it wasn't normal to feel like that all the time. I mean, I just didn't know that people didn't always feel bloated after they ate dinner, and didn't always kind of feel a little yucky all the time. And then when I'll talk about it more when I did the elimination diet, I was like, oh, this is how you're supposed to feel. It's kind of weird how it's like when it's been that way for so long, it's like that's your normal. I don't know. I don't know if that is helpful, but
Yeah,
yeah.
that's massive. I mean, because that's reality. People often think, like you're saying, yeah, I have one bowel movement today. That's normal. No, that's constipated. A lot of
Mhm.
people don't realize that's constipated, one bowel. You having 3 meals a day and you only pooping once, like you backing up twice. So yeah,
Yes.
uh, kind of common sense there. So yeah, this is super cool to go through the genetics. What we're going through here is a panel called DNA Core. DNA Core is a great panel that's been put together by DNA Life, which brings 3 specific panels that they've had around for literally decades into one and really simplified it down nicely. One of the reasons that we use this panel is it's really relatable for our patients. It's very easy for the practitioner to understand with the way the reporting is put together. So I'm going to start from the top. Look, it analyzes a lot. I'm not going to go through each one here. We're going to go through the highlights, but you can see just on the summary page, it's going through a lot. So what we want to do is, again, just stop here for a moment. And I want to, again, just emphasize the areas that we're going to be looking at. The first area, that's not what I want. I want this one. This first area here that we're looking at is all the health factors. What are we looking at? Lipid metabolism. You saw with Amanda, she's got family history of hypertension, diabetes, those cholesterols. So like, are we seeing that in the genetics coming down with Amanda or not? Those are the things that we're going to be looking at there. Insulin sensitivity, methylation, oxidative stress, detoxification, inflammation, bone and joint health. We're also going to be having a look at the nutrition for specifically for Amanda. What is more acceptable for her body genetically to process or not to process? We're going to have a brief look at exercise. What is recommended from a genetic perspective? And then weight management. So that's one of Amanda's big goals. What are we picking up on the weight side, genetic wise, that we can bring into a personalized plan? So this again is the summary. And if you just want to look at the summary, we will look at the genetics. We again can just see that the summary is telling us that there is elevated risk of type 2 diabetes. So that makes sense now with the family history. We're seeing an elevated risk for homocysteine levels on the methylation side. We're seeing suboptimal function of antioxidants. Now, this is going to be relatable because as we age, those enzymes aren't going to be working as efficiently as when we were a teenager. So when Amanda's gone through all the stress and she's had 3 babies and she's gone through 2 surrogate pregnancies, it's a lot of stress on her body. So that is stress is going to then be implicated into our genetics. And we're going to see that in real time, but we can see the genetic predispositions here as well. Detoxification, we've got reduced function of phase 2 enzymes. So we need to be thinking in our plan, how do we now buffer that? We've got elevated risk of chronic inflammation. Now, inflammation is the root cause of all chronic inflammatory diseases, which is everything. So again, that's not in favor. So again, now what are we going to do to counter that? And then we got potential risk with all the aches and pains that you say that you're starting to pick up, as far as bone health goes, bone density. We can look briefly here at the nutrition side. And again, it's going to give us the indication that there is a moderate, this is not highlighting nicely here now for some reason, a moderate barrier to weight loss with carbohydrate intake, a moderate barrier to weight loss with higher saturated fat intake. So we want to be building that personalized plan with the macros to reduce those two. So we're not having them in excess. So macros may be something like going towards a 40, 30, 30, 40 carbohydrates, 30 protein, 30 fats. That may be more in alignment. And the fats, we need to reduce possibly saturated fats, go more towards the enhancement benefit of monounsaturated fats. You can see there, and polyunsaturated. There's enhanced benefit for the weight management. So those subtleties we can already pick up in the genetics here. So these are just micronutrients that may need to be in more abundance than usual. And again, this is going to be a clear indication for us to do some blood testing. Let's have a look at folates. We can do serum folate. We can do organic acids, have a look what's happening there. We can look at B12 levels. We know B12 levels in this situation need to be above 1200. At the upper limit or above in these situations. Choline, vitamin D, we can be testing 25 hydroxy vitamin D because there's an increased need. So in that situation, we want to have it between 60 to 80. Maybe we want to have it more at that 80 level and beyond.
Garrett, can I say something really fast?
Yes, please.
After I had my surrogate baby, they tested my vitamin D, obviously after that. And I was on super dose, well, what a doctor would prescribe as a super dose of vitamin D, and they could not get my vitamin D levels up. But now it's kind of funny because I get my DNA test back and it says that. Oh.
Crazy, yeah. And when we go through those specific genetics, you'll see exactly all the SNPs that Amanda has here. Anything you want to add here? Do you get sensitive to caffeine?
So I think I mean, the first time I had coffee, I was like bouncing off the walls, so that makes sense. But I mean, I only have a cup of coffee a day, and half the time it's not even caffeinated. It's so, I mean, I don't really use caffeine anymore.
Yeah. So you naturally tended away towards like a decaf or just low dose, one cup. Got it. And then do you know if you have a salty meal, do you tend to retain water?
No, I really don't. And actually, that's actually usually what I crave. I don't know if that's normal, but I'm not I don't have a sweet tooth. I'm more like chips and salsa sort of gal.
Yeah. This is interesting because with your family history of hypertension, when you do have these genetics and say you went into high blood pressure, this would predispose you to really stay off the sodium side because it would boost your blood pressure even more. So
I think more I don't eat a lot of sodium throughout the day in like my actual meals. So I think if I do crave something, it's usually probably because I'm probably on the low end mostly.
Got it. And then you've got these genetics that you got a bit of a sweet tooth. Does that sound right?
No, I actually don't. I don't crave sweet stuff at all, which is funny, but.
And so you like the snacking insight? Is that the crisps and that type of thing that you like that's picking up here?
Yeah, I definitely am in that. And I'm not so much anymore after doing some things, but I definitely used to be more of a snacker, like eat multiple times throughout the day.
Got it. And then do you feel you're more of an evening person rather than a morning person?
Absolutely.
Okay.
Yes. I said I didn't need the DNA test to tell me that.
So it's interesting that we got the clock gene, and the clock gene will tell you if you're more of a night person or something maybe we should do before we get married so we don't end up opposites. But
right. Yeah. I was always trying to be the person that woke up and exercised. And if I did, I just didn't feel like I had a very successful workout. And I would just always feel just mad that I woke up that early to do that. But now I've changed to where I exercise more in the evenings and I feel so much better.
Got it. Got it. So
Actually,
your
since having this.
okay. So your genetics say that you tend more towards endurance. Does that sound more like you? Yeah.
Yep. Yep.
Okay. And then what's interesting is you do have some genetics that with are slow recovery. So you may have elevated inflammatory genetics, which we know you do there, and elevated risk, which are often related to collagen formation. So that again may be little aches and pains that start to creep in as we get older and we're not recovering as quickly and that type of thing. And again, we can build a plan around that if needed.
I have thought that my whole life. I was always in good shape because I did so many sports, and then I would be around my friends who didn't work out regularly, and we would go on a big hike, and the next I would be so sore and they would have nothing. I'm like, why am I sore? I'm the one that does way more activities. So when that popped up, I said, oh, I think that might be why I always felt that way, that I didn't recover as fast.
Amazing. So just getting into the weeds a little bit here. So we know you got that family history, high cholesterol, hypertension. We obviously want to have a look at the lipid metabolism. We do have these few here. What does your cholesterol levels look like at the moment? Is that something that you've measured recently?
Yeah, I just had a blood draw like a month and a half ago, and I don't have actually
Nothing
my
relevant.
doctor said I look like a 20-year-old and I should keep doing what I'm doing.
Love it. Love it. So that's what's important with doing these genetics is we need to look in real time. What are those blood works looking like? If anybody wants to see a deeper dive into the genetics and case study, the last live case study we did, which is in our Facebook group in the guide section, you can go and visit that and you can take a deep dive into what we're going through briefly here. We'll probably run through this in a few minutes, but there is a deep dive of that. Insulin sensitivity, you probably checked your blood glucose, your fasting insulin, all good?
Those were all good. I think though that it does help that I've never had that show up weirdly, but I do think the stuff that I've done since starting this program has definitely helped in that department.
Love it, yeah. And I think because you are active, you lean, you're eating well, you're not switching on these genetics because these genetics are very lifestyle driven. So
Hmm.
again, even though we have these genetics, they're in our control. They're known as low penetrance genetics. Low penetrance genetics are only going to be activated if we're doing something wrong and we're
Okay.
actually activating them. So for everybody there, methylation, your homocysteine levels, that's something that you check.
I haven't checked that, but I have that on my list to do that.
Yeah.
I've never had that checked. I don't know. I needed to ask you how to check those.
Yeah, so some nice blood work. Just homocysteine is only one part of methylation that we're checking there, but if it is elevated, obviously we can do something about that.
Okay.
So I think the highlight here is going to be this deletion of the GSTM1, particularly this one. So this is the phase 2 detoxification. And that means that our glutathione, our body's strongest antioxidant, is not going to be recirculating as good as it really should. This is going to lend to anything that you may be struggling with that weight loss, with the energy levels, with the libido, any of those kind of creeping in. We need to support glutathione more. So glutathione would be something that I would suggest looking at, whether it's NAC as the precursor or just glutathione supplement on the whole, when we do have these
Great.
deletions specifically. We do also have the specific antioxidant SNP here, which is superoxidized dismutase 2. And this is the specific antioxidant in the mitochondria. So as you know,
Hmm.
Amanda is struggling energy-wise. That's one of her big focuses. And this, again, can be one of the genetics not in her favor with mitochondria giving you all your energy. And now that SNP may have been compromised. Remember, the second most important antioxidant in the mitochondria is glutathione. So we've just shown you that glutathione is compromised now. Now we've got the two main antioxidants in the mitochondria compromised. So we're going to do what we can do to buffer that. And again, that's going to be all around lifestyle, the correct supplementation to support them, like you can actually supplement with superoxidized dismutase and glutathione if you want to go directly to those two. Okay, going to inflammation. This is a big one. And generally, if we've got anything in this square here, so you've got
the interleukins.
Interleukin 1, interleukin 6, and then we have a CRP here as well. So again, the main thing is just checking bloods to see what is your highly sensitive CRP, what is your interleukin 1, interleukin 6. Is it raised? Is it not? Are you in control? Again, it's going to be lifestyle, nutrition, and then the specifics like the gut, which we'll get into now. So it's just being
I actually did my doctorate research on CRP. That's so funny.
Oh, really? Oh, that's great.
Do they check interleukins with a blood draw as well?
Yes.
Okay.
100% can be done. So this was the big one that you were talking about when you were having the babies, that they couldn't get your vitamin D up. Now we know why. You've got a lot.
Yeah.
So we basically got almost that whole panel there that is compromised. So interesting, what level of vitamin D are you taking at the moment? And do you know your levels? How many IUs are you taking now?
Ooh, I don't know it off the top of my head, but it's the vitamin D2 or D3K2 one. It's a lot.
The 5,000. You're taking 2 of those?
Yes, 2.
2. Oh, so you're taking 10,000. Okay. And then did you do your blood draw recently and do your 25 hydroxy?
Yes, I did do the vitamin D levels the month and a half ago, and they were coming up. I can't remember what they were off the top of my head. I should have sent that over, but they were way better than previously.
Got it. Okay, super cool.
This sounds terrible, but I did not tell my doctor how much I was taking because they think a super dose is like nothing.
Yeah, it's like 1,000 IUs. Yeah.
Yeah, and so I didn't divulge that information, but
Got it. Okay, so let's move on to some real data. Again, this is back in when did you do this test now? So what's the date? This 2, 3
I
months?
think it was the beginning of May, late April, early May.
Okay, got it. So tell me, or tell the audience, what are you seeing here?
Okay, so what really sticks out is that I have no growth of my lactobacillus, which is a huge bacteria that you need in your gut. Even the worst probiotics you can buy over the counter have lactobacillus because it's so important, and I have none. I don't have any 4+ levels of the good bacteria in my gut, so that's frightening. And then also just that I have so many in the commensal group. So you really want 1 or less in that group. And I have 4.
Absolutely. And then we got this one dysbiotic Citrobacter frundi. So the gut could be in better shape, which is okay. The main celebration here is that you've done this test. Now we've got the data. Now we can do something about it. Otherwise, we're just guessing. So
I also did this after I had done the elimination diet as well. That I don't know.
So it may
That's
be
important to know.
shape. Yeah, than before. So interestingly, we do have cultured out a yeast. Now, even though it's in the green, it's very difficult to culture out yeast. And when it does come up here, we can almost assume that it's probably not good.
Yes.
So we're going to bear that in mind. We'll add that into the plan to be able to get rid of the yeast. They wouldn't have sensitized to which botanicals or antimicrobials to use. So we'll have to be doing something on our side here. So we're going to go through. Typically, we don't find anything as far as all the tapeworms and yeasts and protozoas, just because of the limitations of getting that out. It's good. Nothing is picked up in these markers here, yeast, red blood cells, and so on. elastase is looking good, which is great. Your inflammation levels looking great. Secretary IgA a little bit on the low side here. So immune system a bit depleted. Now remember this, speaking to the audience, because that low secretary IgA is often related to chronic stress levels. And we'll pick that up when we go to the Dutch test, and we'll look at what is the metabolized cortisol. And there's going to be a correlation there. That correlation is also going to feed into what Amanda's trying to fix: energy levels, libido, that stubborn weight. When we can get that chronic stress level and the immune system working properly again, then we're going to start to see those shifts happening. So let's move down to this area, which is important on a complete stool analysis in parasitology when we do have dysbiotic bacteria, is what is it sensitizing to? So these tests are so valuable when we have these, because then we know exactly which antimicrobials to use. And here it's telling us the right antimicrobials to use are caprylic acid, uva ursi, and then to use some silver. And this is quite common, particularly with the Citrobacter frundi. And then we will look for those compounds, those specific supplements with these in. And we're going to do that for 12 weeks. And then ideally you'd retest and see, now did that get rid of that bacteria, while we repopulate, re-inoculate with good bacteria. We want to really stay away from all the prescription side, because that's going to be less specific. It will be specific to those, but it's going to knock out everything else as well and create more dysbiosis. Anything you want to add to there, Amanda?
No, that was good.
Okay, perfect. So we're going to move to the Dutch test now. And tell me what you're seeing here, Amanda. What is your analysis of what we see here?
I mean, just my my cortisol levels stuck out to me, as far as the metabolized cortisol, and then some of the estrogen. Sorry, I'm trying to find my sheet. The estrogen, like estradiol, when it went to estrone and estriol, one was super high and one was super low.
Okay, in the metabolites. Got it.
Yeah.
Got it. Okay, so the main highlights here are going to be that there is a big difference between our estrogen here and our progesterone. Between those two, you can see this is on the low end. This one is, although it's on the low end, it's going to be higher than our progesterone. Our testosterone is also on the low end. Yes, this is going to really relate back down to the libido, any inflammation that can be provoked from estrogen dominance. We're going to have a look at the metabolites of this estrogen. Are they going towards the inflammatory, less the not good estrogens as well? So those are going to be key factors here. But there's definitely a difference between our progesterone and the estrogen. The other factor that we're looking at here is going to be the starting point of our cortisol in the morning. In other words, we're starting with a higher cortisol than we really should. This should be mid-zone. So we have got this upset cortisol awakening response. We haven't got this nice curve here. I wouldn't say it's a train smash, but it's not optimal. We're also having this flattening in the afternoon. So you may be having this dips. Often this can be curbed by just having a look at the sufficient macros during the day. Sometimes we're skipping lunch because we're busy, we're with the kids, we're working, whatever it is, we forget to eat, we're having a dip, and that can be catching. But I'd say the most significant is going to be the metabolized cortisol here, which is on the super low side. Now, you remember I said, have a look at the secretary IgA in our complete stool analysis. It's on the low end in the 40s. That is a sign of chronic stress over a period of time, which we've seen on Amanda's timeline. So this just makes sense. She's busy. She's got a family of 3. She's working hard, building a successful business. This is taking toll on her body. And although she's looking great now, we're starting to see it a little bit in the physiology. And this is why it's great to do these tests, because then we can catch things before they really get terrible. I think that's the main So so this is, again, celebration. We're finding things that we can improve. And with any situation where we've got on the stress curve, so if anybody remembers the Hans-Seeley general adaptation curve, which is the stress curve, we're probably more towards the right side of that curve where we're in the depleted side. And to bring that back to a normal acute phase of stress where we're more resilient, it's going to take lifestyle, it's going to take some nutrition, it's also going to take some supplementations to be able to bring us back. Amanda, did you do the stress questionnaire that we work with?
Yes.
Okay. And where did you come up in that?
I was the tired and whatever it was.
Okay.
The one on that side, and I did have a high where is it the adrenal? I was
Right.
very adrenal depleted.
Okay, got it. So that makes sense. We can use questionnaires to validate this again. We've got the symptoms, we've got the data with the labs. We can do questionnaires on a monthly basis, see where we're at, and then we can put a plan together to be able to restore this. Okay. So the next interesting part is going to be down to the metabolites of the progesterones, the estrogens, and so on. Let me make this a little bit smaller if I can. It's not responding to me. Yeah. Okay. I'm going to go up and then because I want to really look at this. So what we're really looking at here is the estrogen, which you'll see initially we had that estradiol coming through here. It's then going to metabolize. It's going to go to E1. It's going to go to E3. And what you'll see is it's going more towards E3 than to E1. E1 and coming down our CYP1A1 is the beneficial estrogen. That's going to be our protective estrogen. These estrogens, although they do have some benefits, when they're in excess, they are going to be not so protective. They're going to be damaging. They can be damaging to particularly DNA. And if I slide this down further, you'll see a little DNA goodie down here showing you how damaging it is. But the fact that we have this imbalance in the metabolites of estrogen is something we want to do something about. So what do we do about these enzymes? The enzyme here is called a CYP3A4 enzyme. We can use botanicals. We can use supplements to downregulate that. Typically, we're going to use bioflavonoids. So using bioflavonoids, you're going to help to reduce the CYP3A4, and then we can promote this pathway using DIMS. So we're going to shift this estrogen as it comes down and slow it down with this enzyme and speed it up with this enzyme. And that's going to give us a more favorable balance. So when we have a look at the ratios here, you're going to see 59. Can you see the 59 with the 16 hydroxy? And it should only be 13 to 30.
Yeah.
The 2 hydroxy is 30. It should be 60 to 80. So that's going to be our key highlight here, that we want to personalize the plan and start to shift these numbers around. And this is very important because it is just so damaging. If I bring this up, you're going to see here 4-hydroxy and the 16-hydroxys, if they're not detoxified, they're going to damage DNA. Particularly the 4-hydroxy is going to damage DNA, 16 as well. We want to get those rebalanced. Okay, we can have just a quick look down here. Your melatonin levels are still in the normal range, but you do have the possibility, if you're not sleeping well, that you could do some supplementation, get more into the higher ranges. Melatonin is also going to block certain of the estrogen receptors. So that can be beneficial. If you've got some estrogen dominance, the melatonin will give you some protection while you're still trying to get these metabolites in the right direction.
Okay.
Let's have a look and see if anything's coming up here. As far as this is the organic acids, part of the Dutch Plus. And we do see some imbalances. The main imbalance that we're seeing here is going to be on I didn't do that very well. Homovanillate, HV8, dopamine. And that is the pathway again that's going to be moving towards epinephrine, so our adrenaline. So again, if our energy levels are a little bit low, we're struggling with that chronic stress, the cortisol is depleted. This is, again, just another significant factor confirming that situation, that you're in that stress state that's chronic and it's in the flattened stage, it's depleted, hypo-responsive state. But I think the celebration is everything else is looking good. It's just that common factor there. So
yeah, it all goes together.
Goes together, exactly. Okay, we're going to start rounding off. And if you do have any questions, please pop them into the chat. We will go through those shortly. We're probably going to just finish off here and then go from there. So this is Amanda's personal plan that she has put together. And these are the supplements that she has put together really well to be able to really combat what we have gone through. Anything you want to add here, Amanda? I don't think we need to go through each one. We're really going through principles here.
Just a couple notes. I did the elimination diet before I had my CSAP test back, and just doing the elimination was life-changing. I didn't think I would be able to cut all those things out. And then I went from not thinking I could do it to 3 days in, oh, I could eat like this forever because I feel so good. And then learned that gluten, dairy, and pork all mess me up when I reintroduce them. But knowing that they're not, I'm not really intolerant to those. It's just my gut is so messed up that that's why I had those responses. And now I'm starting to add those back in, and they're not bothering me, which is nice.
Amazing.
So that makes me feel like my gut is headed in the right direction.
Love it, love it. So this is kind of the before and after test. And Amanda, maybe you want to just kind of highlight the big differences from the previous one to here.
Yeah, so I did this yesterday, and I didn't look at my old one just so I wouldn't be swayed, and I just filled it out how I really feel. And then I went back and looked at my original score, and so I've more than cut it in half. And I think the ones to really note, the things that I really noticed that I just thought were what everybody felt was definitely in the digestive tract one, where you just kind of feel bloated every time you eat, and all of constipation, whatever. I don't have any of that anymore. I also don't have like chronic post-nasal drip and stuffiness in my nose, which I thought it was just random allergies all the time. But that has completely went away from just changing how I eat. So I know that that's like a minor thing, but it's incredible that I just don't have that anymore. And my skin is definitely better. I've lost like 17 pounds without really changing a lot, except for just how I've eaten and not eaten stuff. So, I mean, that's like a big thing. And I really, when I got into this, that was like a main thing that was bothering me. But then when I got into it and learned more, that kind of took a spot on the back burner. But then I've just slowly lost weight without, I don't want to say without trying, because I have been trying to be healthier, but that wasn't my main goal anymore.
Love it, love it. I mean, that's massive. That really is massive. So I'm going to stop sharing now.